Hello, my name is Misty and I am a back office assistant for Foot and Ankle Surgical Associates. This tutorial will walk you through the steps of collecting and sending a tissue specimen. Whenever any type of tissue is collected from a patient, it is sent to a pathology lab for evaluation. It is the back office assistant's job to make sure it is sent that day. The lab we use is a company called Baco. They are located in Georgia, so it is imperative that specimens are sent the day they are collected to ensure prompt and effective results are obtained. Current protocol uses UPS to send these specimens, so it is important that each of the back office assistants is familiar with the pickup schedule as well as the last pickup of the day so we can send the specimens.
There are two types of specimen containers that are used. The first and main specimen container that we use is a small, wet container, which contains a formalin solution to ensure the specimen is preserved. The second is a larger, dry specimen container. In Tumwater and in Centralia, these containers are found within the nurse's station. After the physician has taken the specimen, it will need to be placed within the container and sealed tightly. Next, the pathology orders must be filled out. The prescription forms are found in the specimen container drawer. You will need to fill out the date and time of collection along with the patient's name. There is no need to fill out any address or billing information. Instead, you will print a demographic sheet and mail it with the prescription. So in the area, just write "See attached." Next, you'll need to fill in the section which states additional clinical information by writing a brief description of the specimen and place of origin, as well as the ICD-9 or ICD-10 code for billing purposes. The last portion of this paperwork will be to fill the proper description in their paperwork under clinical information. You'll need to specify right or left, the type of specimen, and then label the diagram in the center showing where it was physically taken, and have the physician sign or stamp the physician's signature. The original copy will be added to the demographic and sent, while the carbon copy will be turned into the front desk to be scanned into the patient's chart. You'll need to print out a demographic sheet to send to the laboratory. To print out a sheet, simply find the patient's name on the schedule and highlight it. Then to the top right bar, you will see letters. Click that button. Scroll down to find demographic sheet. Click on it and press the print button. You will need to choose which printer to send it to. If you're in Centralia, choose FASA Centralia. In Tumwater, choose FASA Tumwater. Collect the sheet and add it to the pathology orders. The specimen, demographic sheet, and pathology orders will then need to be added together in a biohazard bag. Put the specimen in the Ziploc portion and the demographic and pathology orders in the front pouch. You will then need a UPS laboratory pack and shipping label, which are located in the nurse's station with all the pathology supplies. The pre-printed shipping label is to be placed on the front of the laboratory pack in the spot that states "Place this label here." The biohazard package with the specimen, demographic sheet, and pathology orders will then be placed in the pack, and the pack is to be sealed by pulling the red material strip. This will uncover adhesive that can be turned over. You're almost done. The last step is to schedule a pickup from UPS. To do this, call the number shown on the laboratory pack, which is 1-800-PIC-UPS. This will lead you through a series of prompts to schedule the pickup. At any time, say "Speak to a representative" to talk with someone, and they can help you schedule the pickup. Remember, each office may have different last pickup times for the UPS, so make sure you send the specimen as quick as possible and be careful to know when the last pickup is in each office. When a patient has a new or ongoing infection, the physician will oftentimes take a wound culture using a culture swab. You'll need to retrieve a swab from the top drawer in the room and open the pack. The doctor will twist the cap off and take the swab from the container to swab the patient. You'll then place the Q-tip swab back in the container and seal it. You'll need to write the name of the patient, date, culture taken, and doctor name on the swab. This information is very important, and it's crucial that it's placed on the side of the swab, or the lab will throw it away. In Tumwater, you'll need to print out a demographic sheet and have the scribe write a prescription for culture and sensitivity for the specimen. Place the prescription and demographic sheet along with the swab in a biohazard bag, and you'll need to schedule a pickup. To do so, we use Capital Courier, so you'll need to call the number located at the nurse's station, and they will pick up the culture. Place the culture at the front desk to be picked up. In Centralia, you will do all the same preparation work. However, it's a different lab we're sending it to, so instead of doing a prescription, you'll need to do a demographic sheet along with a special pack lab prescription found in the back with the culture swabs. You'll place it all in the biohazard bag and take the key from the front desk and put it in the back hanging specimen box. You'll then need to call PackLab for the pickup.